Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. Today we are going to talk about a very important topic. In fact, it is the burning topic. The COVID-19 chronology and neurology. So we're going to talk about the burning topic COVID-19. The COVID-19 chronology and neurology. COVID-19 infection by and large is not dangerous. 80% of the patients affected by COVID-19 recover on their own without much treatment. It is only the unfortunate 20% who may go into the next stage known as the Cytokine Storm stage, where they may have severe symptoms and sometimes fatal also. So to understand how to approach a COVID-19 infected patient and what is the best possible treatment for such patients, we need to understand the chronology. How the disease starts, how it evolves, the stage 1, the stage 2, and before that, the incubation period. Because treatment differs according to the stage. For the symptomatic stage, that is mild and moderate symptoms, we do not do much. We just give paracetamol or cough syrup, that's it. But once it enters the next stage, the cytokine storm stage, there we really intervene, give oxygen, ventilator, steroids, and anticoagulants. In fact, steroids should not be given in the symptomatic stage, that is the first 7 days. So to understand the various modalities of treatment, we should understand the stages of COVID-19 infection, the chronology of events. Likewise, the neurological manifestation of COVID-19, to understand, we need to know the stages of COVID-19 infection, the chronology. For example, anosmia, loss of smell, occurs in the early part of the disease because the virus goes and affects the olfactory epithelia where there is angiotensin converting enzyme 2 receptors. But the stroke, ischemic stroke, what we see as a complication of COVID-19 infection, occurs in the cytokine storm stage because of the hypercoagulable state. So to understand the neurological manifestations of COVID-19 infections and to understand what is the best possible treatment at that particular stage, we need to know the chronology of COVID-19 infection. So first let me talk about the COVID-19 chronology and later address the neurological manifestations. Right. The COVID-19 infection, there are 3 stages. It can be compartmentalized into 3 stages. The first is the incubation period, the next is the symptomatic phase, and the next is cytokine storm phase. We can remember all these stages by a simple rule known as rule of 5. Rule of 5. The incubation period is the period wherein the virus enters and to the development of the first symptom. That is, it's a pre-symptomatic stage. The entry of the virus to the development of till the development of the symptoms, we call that as the incubation period, which is usually around 5 days. 4 to 11 days, but usually around 5 days. Here the virus enters the host cell attaches to the angiotensin converting enzyme 2 receptor and becomes a part of the human body. So this is the first stage, the incubation period. Then the actual symptoms starts, what we call it as the symptomatic phase, which is in 80% of the patients. So 80% of the patients recover on their own without much treatment, and they do not go to the next serious stage, which is known as cytokine storm stage. Only 20% of the patients enter. So 80% of the patients get cured in the symptomatic phase, and we need not worry about patients who get cured of the symptomatic stage and do not enter the cytokine storm stage. So symptomatic stage is seen in 80% of the COVID infected patients. So this phase usually again lasts from 1 to 5 to 7 days. This stage is because of the rapid of the immune response against the COVID virus infection. The COVID virus is considered as a foreign organism, and therefore the human body mounts immune response against the COVID virus. So our immunity goes and controls the viral replication and the viral infections, and most of the time it gets completely controlled. But once there is an antigen, that is COVID virus, and antibodies, that is the immune response from our body, the reaction produces a lot of chemicals which cause symptoms. So the symptoms are fever, sore throat, body aches, cough, and diarrhea. The chemicals produced during this antigen-antibody interactions are interleukin 6, tumor necrosis factor, which causes an elevation of ESR and CRP. The virus can enter through the nose, mouth, or various orifices. So these are the symptoms what we see in the symptomatic stage. By days 5, most of the time, or maybe extended by plus or minus 1 or 2 days, the symptoms by and large gets controlled, completely gets controlled. All we have to do is perhaps give paracetamol to combat the fever and body aches, and cough suppressants. This we should give. What we are not supposed to give are steroids or anticoagulants at this stage. A very important, indispensable concept. We should not make mistake at this stage. This is just symptomatic stage, a viremic phase where our immune has been mounted and tries to control the viral infection, and therefore just paracetamol and cough suppressants are enough. We should not give steroids at this stage, because if we give steroids at this stage, the immune response becomes impaired and therefore the viremia increases. So we should not give steroids, and at this stage we should not give anticoagulants, because at this stage there is no blood clot. In fact, there will be serious side effects of anticoagulants like bleeding. Very important, 2 do's and 2 don'ts. The 2 do's which we have to do is to give paracetamol and cough suppressants, and the 2 don'ts are steroids and anticoagulants. So the prognosis, 80% of the persons get better. It is only the unfortunate 20% who progressively worsen and enter the next dangerous phase, which is known as cytokine storm phase, which is about 20%. So here the symptoms go beyond 5 to 7 days. So how do we recognize this stage? The fever, which is supposed to get subsided by 5 days, doesn't subside. It continuously progresses and sometimes increases. The cough worsens, and the persons will start developing breathlessness. What is the pathogenesis? Why do they develop breathlessness? This is because of the massive immune response and autoimmunity. Since the immune system is not able to control the virus, there will be massive immune response. There will be molecular mimicry between the virus and other structures of the body like arteries, veins, lungs, liver and intestine. Because of the similarity in structure of arteries, veins, lungs, intestines and liver, the immune system not only attacks the virus but also attacks these structures. It is a mistaken identity. So once it starts attacking the arteries, the immune system, once it starts attacking the arteries and veins, the blood clots. There is a thickening of the blood clots. Once there is blood clot, the free flow of blood is impaired. It becomes sluggish and therefore the oxygen exchange between the lungs and the blood vessels does not take place and the oxygenation starts falling down. We can pick it up by pulse oximeter. Generally, the oxygen saturation is more than 92%. Suppose there is a progressive fall of oxygen saturation below 92%, that indicates there is an impaired oxygenation between the lungs and the vessels of the lung. So this is going to be a very life-threatening stage. We should pick it up early and start treating. Since the oxygenation is impaired, we have to give oxygen, and some patients who are in serious trouble may require ventilator. So in this stage, the advanced stage, the cytokine storm stage, only we give oxygen and ventilator. And at this stage only we give steroids, not in the symptomatic or mild or moderate symptomatic phase. Only in the cytokine storm phase, the advanced phase, we give steroids. Why do we give steroids at this stage? Because of the massive immune response mounted against the virus and the structures which are similar to it. The blood vessels are getting destroyed, the blood clots and the oxygenation is impaired. So we have to reduce the immunity at this stage. So at this stage we have to give steroids at the advanced stage. At the early stage we should not give steroids. So at this stage we give steroids for about 10 days to decrease the immune system. But sometimes persons with comorbidities like diabetes or hyperglycemia who are also on steroids, the immune response becomes so much impaired that there is an upsurge of bacterial infections which we have to treat with antibiotics. Sometimes black fungus, what we call as mucormycosis, rhinocerebral mucormycosis can occur, where we have to give antifungals like amphotericin. So here at this stage we have to give steroids, sometimes antibiotics and antifungals depending upon the pathogenic organism. And at this stage we have to give anticoagulants for about 20 days. Because the blood is clotted, it is not able to move freely, there is an oxygen exchange impairment. We have to give anticoagulants and lyse the thrombus so as to allow the free flow of blood. So this stage is very crucial. We have to pick it up and we have to give appropriate treatment in the form of oxygen, ventilator if required, steroids and anticoagulants. Steroids for about 10 days, anticoagulants for about 21 days. This is very important. So we have 3 stages. The incubation period, that is the pre-symptomatic stage. The symptomatic stage where we need not do anything 80% of the time other than giving paracetamol and cough suppressants. The third stage is the dangerous stage, cytokine storm stage, the advanced stage where there is a tendency for hypercoagulability, and at this stage only we see the CNS manifestations like stroke, ischemic stroke, and therefore we have to give anticoagulants, we have to give steroids. So having understood the chronology of COVID-19 infection, Now let us see the neurological complications or the presentation of the COVID-19 infection. So the COVID-19 virus enters the brain either via the olfactory epithelium or hematogenous spread. The neurological complications of COVID-19 infection are due to the direct viral infection or due to the immunological reactions or due to the hypoxic metabolic changes. So either due to direct viral invasion, immunological mechanisms or metabolic hypoxic changes. The neurological presentation of COVID-19 infections can be divided into two. One, the central nervous system presentation. Second is the peripheral nervous system presentation. In the central nervous system, the manifestations include headache, very commonly seen, stroke. Stroke is because of the coagulopathies. As I said, in the cytokine storm, there is a tendency for hypercoagulability, and therefore because of the hypercoagulable state, there is a tendency for stroke formation, which can be picked up by D-dimer estimation, which is more than 1000 micrograms per liter. And the coagulopathies enhance the risk of cerebral, arterial and venous thrombosis. The other manifestations and presentations in central nervous system due to COVID are the metabolic complications like metabolic encephalopathy, sometimes occipital cortex is involved, what we call the stress posterior reversible encephalopathy syndrome. There can be hypoxic encephalopathy, hypoxemia, because of again blood clot and decreased blood flow to the brain, and there can be encephalitis, inflammation of the brain. So these are the central nervous system manifestations and presentation of COVID-19 infection. Now let's see the peripheral nervous system presentation and symptomatology of COVID-19 infection. Anosmia is very common, loss of smell. In fact, 85% of COVID patients may suffer from anosmia, loss of smell. This is because of the direct invasion of the virus to the olfactory epithelium getting attached to the angiotensin converting enzyme 2 receptor. So anosmia, and second common peripheral nervous system symptom is ageusia, loss of taste. So loss of smell, loss of taste are very common manifestations, neurological manifestations of COVID-19 infection. The others are myalgia, muscle pain, again because of direct entry of virus into the muscle through the angiotensin converting enzyme 2 receptor. They can have Guillain-Barré syndrome as an immunological dysregulated mechanism, post-infectious mechanisms, and then they can have diffuse neurologic pains. So to understand the neurologic presentations and manifestations of COVID-19 infection, for example, anosmia occurs early in the COVID-19 infection, but stroke occurs in the advanced stage of COVID-19 infection, and especially the treatment part, when to give steroids and when not to give steroids, when to give anticoagulants and when to give oxygen ventilatory therapy. We need to understand the chronology of COVID-19 infection. So basically there are three stages: incubation period, symptomatic stage, nothing is necessary other than paracetamol and cough suppressant, 80% of the time get cured on their own. Only the unfortunate 20% enters the cytokine storm phase, where there is a hypercoagulable tendency because of massive immune response and autoimmunity. At this stage we have to give steroids, oxygen ventilatory support and anticoagulants. Because of steroids there can be bacterial or fungal infections, then we have to give antibiotics, and if there is fungal infection like mucormycosis, we have to give amphotericin. So understanding the chronology of COVID-19 infection is of paramount importance in treating COVID-19 patients and making the patients better. And I repeat, more than 80% of the patients inflicted with COVID-19 infection become better, and therefore we can be confident and approach persons with COVID-19 infection and give them a lot of confidence, because once we give them a lot of confidence, words of courage, the placebo effect takes place, and the immune systems also, the immunity also increases, and the persons are able to combat the viral infections better. So we should see as doctors that the COVID afflicted patients should not get stressed, anxious, depressed, or fearful. We should instill them a sense of courage and confidence. I hope you have enjoyed listening to my lecture as much as I have enjoyed delivering it. If you have any suggestions or comments, kindly post on to my YouTube channel. But please like and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.